Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. I'm in the car with the beautiful Miss Heather Johnson. Say hello.
Hello.
Hello. And in this video, I want to talk to you about the power of thinking outside the box to resolve your Piriformis Syndrome, your pain in the butt. All right, so if you're watching this video, then chances are you are trying lots of different things to get rid of the pain in your butt, but it's just not working. So either the treatment that you're receiving isn't working, and or it may be backfiring on you, making you worse, and you just feel stuck. So just know that if you watch this video and you apply the nuggets that I'm about to share with you, it will massively improve your chances of getting rid of the pain that you're experiencing. So look, the primary reason that your treatment isn't working is because you, as well as every professional you've seen to solve this problem, has been trained to think linearly. So in order to solve your pain in the butt, you need to ditch the linear thinking and adopt what I call systems thinking. So let me explain. So you, your doctors, your surgeons, we as humans have been trained to see things linearly. We are taught to look at cause and look at effect. If you have Piriformis Syndrome, do this. If you have sciatica, do that. We have been told to look for the diagnosis, and that equals the treatment that you'll receive. But if that worked so well, that old, what I call outdated medical diagnostic model, the old diagnostic paradigm, if you will, then why do people all over the world reach out to me and still suffer with pain? Why is it not working for you? The traditional stretch this and pull on that and use the massage ball and foam roller and this and that. And why is it that nobody can figure out what's going on with you? Here's why. So the reason that treatment is not working and why you cannot figure what's going on with you is because the world is glued to this linear thinking versus a systems approach. Linear thinking is very narrow, and it basically disregards the complexities of that which is the human body. And it focuses just on treating the area that hurts, right? The one aspect of the entire system. So you've got this whole body, 100% of the system, and you're focusing maybe on the 25% that hurts, right? You get MRIs of your back, you get shots in your butt, you get massages to your back, your butt, your leg, but nobody thinks about anything else. It's as if everybody has blinders on to the fact that you're more than just a pain in the butt, all right? You're more than just where you experience pain. You've got other things connected to that area. Linear thinking gives us comfort, right? Because it tries to make things black and it tries to make things white, black and white. But the truth is that things are really gray, especially when it comes to being in pain. Linear thinking gives us permission to only look at that which makes sense for us and encourages us basically to dismiss and or forget about things that don't fit within our worldview and or understanding. Just because we can't understand something doesn't mean that there's not an explanation for it. And then we wonder why treatment to the area of pain and only the area of pain isn't working and why we still hurt. So again, consider that you're focused on the 25% or even just the 10%, if you've got a pain just in the butt, right, of the body that hurts, when in order to heal, you need to focus on the 90% of the body that doesn't hurt. So for example, instead of stretching and treating your painful butt cheek and or sciatic nerve or back even, right, why not focus on moving areas of the body that do not hurt? And instead of trying to fix or treat Piriformis Syndrome from a place of fear, scarcity, or lack, like I need to do this or else, why not remove the pressure, not only move the 90% or the 75% of the body that feels good, but do it from a place of joy, authentic, I want to do this, I want to move and stay active while I allow my body to heal. And this does two things. Number one, it allows you to move your body in a way that feels safe and move in novel, pain-free ways. That's the first thing. And instead of doing stretches and movements that hurt, which aggravate the area, why not find yum emotions and use yum emotions to fix a yucky experience? On the brain side of things, you reduce the threat. So instead of training your brain that movement equals pain, you begin to move in ways that feel good, which reduces the fear of movement, and it improves your confidence and places you on the path to healing. So I know this might be totally backwards, but I'm just telling you it's a massive nugget if you're willing to apply it to your life, and it's just something to think about. So a bit of inverse thinking and non-linear systems thinking, which challenges the traditional way of you trying to solve this. Instead of looking at like isolated pieces of the puzzle, your back or your butt, just consider that the whole body's connected, both the brain and the body, and that is where true healing will occur. Instead of forcing treatment local to the area, you need to think outside the box. So hopefully this was useful. There's lots of ways you can apply this, not only as it comes to resolving your pain, but also other areas of life. Let me know your thoughts in the comment. Hit the subscribe button as well as the bell for notifications when we go live every single week. The beautiful Miss Heather Johnson is back, and I think we're going to get some pizza. Thanks, everyone. Chat soon.